We are going to do one case presentation. I'm going to explain the case, so you can ask as many doubts as possible, as many questions as possible. Basically, you are going to assess the patients. I'm going to give a basic information. You can ask me the question, which you do during the spot of assessment. What all the tests you do, what are all the movements you check, what are the questions you ask to the patients. You can ask me. If you have a patient assessment sheet in my hand, so I can look at it and I can answer. 18-year-old male student who came with the complaints of right shoulder pain while playing badminton. This was his complaint. And also he had a same side trapezius and the neck pain. He complains slightly the neck pain. So you can start asking me the question.
So while playing badminton, what are the positions he had been playing?
Yeah, usually he had a pain while smashing and clearing the rack.
Mostly the overhead.
Overhead movements, well, forceful movements. When he performed above 60% of his intensity, he had a pain.
How long is having this pain?
This is very important question. Having the pain last after April 2023. This is March, almost 11 months.
When he started to play badminton?
Playing past 4-5 years he's playing.
Is he a professional or a recreational?
No, he was studying sports science, BSc sports science. During his curriculum, so he was playing a lot of games, but he's patient towards badminton, so he's playing badminton continuously.
Any previous history of same pain or any other?
Another important question. He had a left leg ACL reconstruction last year. This is where you have to ask the main question is when ACL injury happened, how long he took surgery in between. This is one of the crucial question. See, exactly April 2023, later he started having shoulder pain. The same April when he doing trekking, while downstairs his leg got twisted. He got same April, he got a knee pain. And end of the April, he started having shoulder pain. He thought that something is not serious, so he didn't take care of seriously. Then August, the same year August, while playing, he got twisted again. After that, he visited the doctor. They suggested the full tear. You need to go under surgery. And October 2023, he did surgery. Exactly 6 months over, but he started playing 3 months later. After surgery, 3 months later, which is not a right way to start playing after ACL reconstruction. He started playing after 3 months of ACL reconstruction, but light intensity. Now he's playing with high intensity. He was comfortable with that, but shoulder pain started having.
Did he follow the proper rehab of the ACL?
Simultaneously, when I check ACL, ask him to perform single leg squat and other movements, his leg is not that good compared to the unaffected leg, which I noticed. Left leg is velocity, force production component. It's not that efficient.
He's having right shoulder pain, and previously he was having ACL injury. And he got surgery. He did surgery. But why this shoulder pain? Why you assess the ACL part? Why you assess the leg strength?
So the reason which I believe is the badminton person, he was complaining of pain while smashing. Mainly aggravating factor of the pain is smashing, right? So aggravating factor of the pain is smashing means he also take a lot of force to increase the vertical jump, high distance to increase the momentum of the racket to hit with maximum velocity to beat opponent, right? After ACL injury, left leg, he couldn't able to jump efficiently to generate a rotational kinetic force. So he may end up having overusing the right shoulder after the ACL injury. This is how I correlated with that left leg ACL injury to that right arm shoulder pain.
Already had a previous injury. Did he tell from this side or you had?
No, I asked. Usually, you ask na past medical history. Do you have any past medical history? At the time, he told that I have a ACL reconstruction on October 2023, and I asked when you had injury, and he said April. When you have shoulder pain after April.
So what is the pain intensity?
The pain intensity, the person told me that 7.5 out of 10.
Does he have pain even at rest?
No, rest is makes more comfortable. The actual aggravating factor, as we discussed, the smashing and clearing.
What is the sensitization of the pain?
The sensitization, I have to explain what is sensitivity of the pain first of all. Once the pain aggravates, how long it persists to settle or come back to zero, it is called sensitization of the pain. It is considered as a high sensitization, moderate sensitization, low sensitization. So considering this patient, he told that 1 or 2 minutes, it gets settled down quickly. So I am putting into the low sensitization category.
How about the range of motion?
Range of motion, active range of motion deficit, which is noted minimum 10% in all the planes of movement.
Is Paynak syndrome is positive for?
No Paynak syndrome is positive. He can able to lift. There is no structure. There is no Paynak syndrome positive.
What about the muscle power?
Muscle power, when I assess him, he have a little bit less efficiency on the painful side compared to the non-painful side, and he complains mainly horizontal adduction is painful.
So what about the external rotator strength?
External rotation is weak when you compare to the other side. That's why he have a right side neck pain, because the deltotrapezio complex. When the person have weak posterior stability, the person complains neck pain. Whoever come with shoulder pain, if they along with that they complain the right side or left side, the same side neck pain, they might end up having the posterior shoulder stability issue. Definitely there is high chance of having. So after assessing, when I ask him to take 2 kg of dumbbell and ask him to do external rotation in a side lying position, he can able to do comfortably on the unaffected side of a 12 repetition. If the affected side, he did only 6 repetitions, 7th repetition itself started having the trapezius pain of overactivation of the trapezius and underactivation of the posterior shoulder stabilization structures, I can notice.
Any fear of movement?
Fear of movement is not positive. What is fear of movement? The person is having fear to do that activity again. It's not like he was a sports person, he was playing again and again, playing causing pain, but sensitivity is low, so he was managing to play. There is no fear of movement.
And what about psychosocial factors?
The psychosocial factor is not that negative, because very pretty young person, active and young person with good having good sleeping habit and lifestyle factors. It's not disturbed so much, because in simultaneously had a ACL injury as well. So he was prepared for that time going for the rehabilitation and everything. So it's not affected mentally that much.
What about the rotational mobility, thoracic rotation?
A thoracic rotation mobility we didn't assess, honestly speaking, because before that I can able to come to one conclusion to the diagnosis. So I didn't check, because I thought that during the sessions, because every session assessment, that is what we are considering and proceeding, right? During giving the exercise, we can catch up and we can note down, we can proceed next. That is the reason. So I didn't assess that.
So where is the location of the pain?
Location of the pain, he complained superior anterior aspect of the shoulder.
Did you do any special test for assessing the
Special test, there is no specific cluster for this kind of overuse pain. Came to conclusion that rotator shoulder pain is the main classification of the impingement syndromes of the shoulder joint. So when I consider that there is no sustained positive, there is no painful large syndrome positive, and weak external rotator was there, and he was complaining the pain over the neck because of this connection between the deltotrapezio complex. Final diagnosis is rotator shoulder pain, which we diagnosed. It was happened due to overuse of the right shoulder because of the injured left leg, which has happened. So he couldn't able to generate the force to vertical jumping to smashing. So he overused the arm to beat an opponent. So he is end up having that rotator shoulder. So
what would be the perfect treatment? Correcting the overuse of shoulder or correcting the ACL? Like, we can improve the stability.
Yeah, the perfect treatment is actually is to improve the vertical jump height, treating the advanced rehabilitation of the ACL injury to get back to proper guidance of the return to sports management. One aspect, the side by side another aspect, ask him to reduce the workload, and strengthening the shoulder joint muscles, as well as improving the range of motion simultaneously. So by doing this both together, we can improve the person pain intensity of the shoulder joint, and we can make him perform better in upcoming events.
Hope this video was very helpful to you. If you like this video, subscribe to our channel.
So if you have any doubts related to this case presentation, the discussion of this case, you can put it in the comment section. We'll try to improve our presentation and case information, how we are diagnosing in upcoming videos. Thanks for watching.